We want to hear from you. Follow us on Twitter, Facebook, or go to KCMXAM.com and go to the Talk to Us tab. Send us your thoughts. Lively conversations around news, politics, and people, plus local news and weather every 30 minutes.
Good morning and welcome back. Sorry about that. We had waiting for our guest to call in, Rob Schwartz, and I was trying to raise him on the phone. And we've got a phone call. Let's see who we've got. Good morning. You're KCMX. You're live on the air.
Hi, it's Rob Schwartz.
Oh, hey, Rob. How are you?
I'm good. How are you?
Great. Thank you for calling in. We were kind of waiting for you and got you going. So glad you can take this time. I know you're super busy because you're going to be attending this surgery center in Oregon, right? This tour, the legislative tour? Correct. And I wanted to introduce everyone to Rob Schwartz. He's the director for the Oregon Ambulatory Surgery Centers Association of Oregon. And Rob, thank you so much for being with us this morning. You know, we talked about the ambulatory surgery centers, and I always called it outpatient. I think folks kind of understand it as being outpatient, you know? But this is taking it to another level. Do you want to kind of describe to our listeners what's happening? What's been happening?
Well, you know, a number of people have trouble with the word ambulatory, which means just walking. Walk in, walk out. Some call it one-day surgery. Some call it just surgery centers. But in this whole conversation we're having in this country over the last few years about the cost of health care, which is still dramatically surging and worrying people very candidly.
Yeah.
People are looking for a silver bullet. And the truth is, there are answers out there, and one of them that we're trying to highlight are one-day surgery centers, where you can have most surgeries, many surgeries, at far less cost than being in a hospital. And what we're trying to do is to underscore and explain to both businesses and just average citizens that there are alternatives to getting surgery that is safe, with terrific outcomes, and it's very close to their homes.
Right, and the real separation is whether or not you need to be hospitalized either for observation or recovery. Is that correct?
Absolutely. It is routine, if you will, for physicians and nurses to do a workup, and only accept patients that are appropriate to have surgery in surgery centers.
Okay.
So, for an example, a heart patient would not be getting surgery in a surgery center.
Exactly.
Someone, the expression they use are comorbidities, someone with other health issues that could threaten their life by having a surgery in a surgery center because of other major health issues, would not be a candidate.
Yeah, exactly right. Exactly. We've got Rob Schwartz on the phone with us this morning. He's the executive director for the OASCA, which is the Oregon Ambulatory Surgery Center Association. And we've got a quick little break I want to take and then come right back. And I tell you, I'm going to be describing what goes on, and you can kind of make the decision whether or not, I'm seeing, Rob, all across the country, the rates are significantly less, and it's a success as far as offering health care that's saving money.
Absolutely. It is, for consumers, a terrific way to address their health care needs, and very safe.
Yeah. Excellent. All right. Well, it's just a short little break. We'll be right back. So stay tuned. Don't miss this. Back in a moment.
On KCMX News Talk 880.
Good morning. Welcome back. About 12 minutes before the hour, we've got Rob Schwartz on the phone with us. He's the executive director for the Oregon Ambulatory Surgery Center Association and out of Portland, and they're down today to kind of have a legislative tour in Medford. And the great thing is, and we were talking about this just briefly, is the economic impact of surgery centers in Oregon. Rob, you want to take that because it looks like it is a huge economic impact for any of the groups that take this type of thing on.
Absolutely. One of the things we wanted to do, particularly in light of the economic problems that has beset the country, and in particular the state of Oregon, was to conduct a research study to be able to determine what kind of contributions does the surgery center industry contribute to the Oregon economic engine. And our research study showed that in 2012, the total statewide economic impact was $611.6 million. That's a significant injection of money into the economy, and what that translates into is purchasing supplies and materials in the state, hiring people for quality jobs, and not just physician jobs. We're talking about nurse techs, nurses, receptionists, folks that clean the surgery centers. So another part of the study showed that a dollar spent by the ASC industry, ambulatory surgery centers, generated, for every dollar spent, $2.21 of economic value was created within the state.
Yeah, that's fantastic. And I'm looking at this chart, and it starts out by being all the surgeries, the surgery centers in Oregon, expenses, they spent $257 million. And when you take that into the multiplier, because obviously if you're buying all of the gear and expenses that would go along with that, like you just described, that multiplier of providing for the businesses that provide for the ambulatory surgery centers, correct?
Absolutely.
Yeah, we're really big on that multiplier because we just were talking about jobs and the timber industry down at Cave Junction, and 85 employees just lost their jobs over at Rough and Ready Lumber, and that salary is a $3 million a year salary, but the multiplier can be as high as $15 million that's lost for that region over there. So, you know, that's only $15 million, and here you're talking $250 million roughly, and it goes to over $600 million when you add taxes and expenses and everything else.
Absolutely.
Wow, that's fantastic, especially when we're hearing kind of at a nationwide level that how are we going to provide for 30 million new insured individuals, right? Isn't that kind of what people are looking at, is trying to provide care for all of that?
That's true, and the ticking time bomb, there's actually two ticking time bombs with what you just discussed. One is if those individuals who are coming in through Obamacare are sent to hospitals, and the state has to pick up the tab for Medicaid, for example, and for Medicare, you're looking at a significant financial hit that the state will take. And so it is important that those people are not directed just to hospitals, that there are other providers that can offer care at more significantly lower costs, which will take the pressure off the state budget.
Yeah, I mean, well,
which is happening, if I could just inject, we are competing in this country, believe it or not, with foreign countries like India, and it's called foreign international care, that are offering these incredible cut rate prices for major surgery and are attracting people from this country to go and get their health care in other countries. So if we do not get on the ball, so to speak, and understand that we are facing competition internationally in healthcare, we are going to suffer as well in that regard.
Wow, Rob, that is really something. And if you're just joining us, you're catching the tail end of the interview with Rob Schwartz. He's the executive director of the Oregon Ambulatory Surgery Center Association, and they're having a legislative tour down in Medford at the Surgery Center of Southern Oregon. And really, of course, Dr. Alan Bates is scheduled to be there, and along with the Oregon Representative Sal Escobar. It'll be interesting to see what the takeaway is from Dr. Bates. Of course, he's familiar with all of this. But the numbers and as this comes at us like a tidal wave, and I've been wondering what's going to happen as this rolls out with the CARE Act and health providers because of the issue of doctors retiring or, the billing issues and everything like that. And yet here is kind of a winning formula for outpatient surgery to kind of keep the costs down. And I'm seeing across the board, you are providing a great service, and the costs are less. So
they are, and we're pleased that these legislators are coming. We are actually on a barnstorming tour. We started in Portland yesterday in Salem. We had legislators touring today, Medford, tomorrow, Grants Pass, the next day, Coos Bay, and then back up into Bend, and then back into the Portland area. It is important for us to educate legislators, although I will say Senator Bates has been a strong supporter of this industry, and he understands that more choice is critically important.
Yeah, and that's we've talked about that, and he's great. And Rob, I'd like to have you on at a later date when, like you said, the barnstorming tour has kind of calmed down a little bit, and I'd like to hear the takeaway. We don't have time today, but I'd like to hear the takeaway from all the legislators as far as what they saw and how this is going to benefit the state of Oregon. I mean, this multiplier for every dollar goes to. I mean, you're doubling the economic value of that. So pretty impressive. So great numbers, Rob. I so appreciate your time this morning.
Thank you very much for having me on.
Well, this is going to be fantastic. And of course, you're after you finish here, you're going to be going to, was it Grants Pass? And then
Grants
back up
Pass,
to,
then Coos Bay, and then swing back to Portland, and then over to Bend.
Now, is there I've got time, is there a website? I saw the ascassociation.org, but is there there's a Oregon, right?
We have a website as well. And if you just type in OASCA or Oregon Ambulatory Surgery Center Association, it'll bring you to our website where we have our surgery centers listed. I would add, part of this education program is really to make the case to insurance companies that they need to not only contract with surgery centers, they need to educate their customers, people who are out there looking for a better way to spend their dollar, that there are other choices. Without a partnership with the insurance companies in this state to really educate consumers, we are all going to suffer.
Yeah, we are.
Because not enough people know that choice is possible.
Good deal. Rob, we'll put that on our Facebook page as well. Rob Schwartz, ladies and gentlemen, Executive Director for the Oregon Ambulatory Surgery Center Association. You can go to OregonASC.com. Rob, thanks so much.
Thank you. Have a great day.
Start your day off right.
Bye-bye.
Catch the sunrise on KCMX AM 880. Sunrise, where it matters what you think.